Tell me your story.
I was this close to dying from a brain abscess that was misdiagnosed.
Good to know people care, though.
For a lot of people, the MRIs are clear.
You said you had a lot to tell.
Oh, yeah.
Someone said,
I thought it was normal to have like seizures by yourself all the time.
You definitely will feel guilt a lot.
I so appreciate you putting this together.
thank you. I got something here. It says ambulatory EEG at work. I'm supposed to have an ambulatory EEG after a recent seizure. I'm not able to do it entirely over the weekend, so I'll have to go into work one day with an EEG leads on. Has anyone worked with an EEG leads on before? How did it go? I'm most concerned about how other people will perceive or treat me. I work as a lab tech at a biology research lab, so I'll be moving around a decent amount as well, but I think I can be careful and not rip off my leads by mistake.
I
I would
suggest,
say just go ahead, Angel.
I was going to say, I suggest use some sick days and everything because that's what I did every time I had to do an ambulatory. Because they also have you sign a waiver, like if it breaks or whatever, you got to pay for it. But it's just you're going to be moving around so much, you could mess up, the readings or whatever. Like it's best not to, do all that stuff.
I was gonna say just obviously be careful with how you move and everything. Since it's only a little bit, use a sick day if you can. I don't know if I mentioned before, I had a feeding tube in me for about like a month or so because I had really bad pancreas issues, and obviously I couldn't really take a month off of work, and I was a mechanic slash salesman at the time, so for the first couple of days I was kind of nervous, like what are people going to think about it or something, but then I just got over it and I'm like, this is what I have to do. If somebody gets mad at it or whatever, then screw them. I have to do this to stay alive. So I just wore it every day. People would look down and kind of stare at it, but it was what needed to be done. So I would say just don't. It's not going to be that big of a deal. Like if the person should understand, and if they don't, then like screw them. Who cares what they think? Like you got to do what you got to do.
Don't
Get
let
used to
anybody
bathing with a hand towel.
come again.
I said get used to bathing with a hand towel.
Oh,
Well, thankfully with the feeding tube, there was like a quick disconnect. So I mean, I obviously still had the tube like through my nose and down into my body, but I could take the bag and the back, part off and at least shower with it. But yeah, I did take being a little bit of, little more careful to do that. I know you were saying that to the other person, but I'm just saying like in general too.
The
It's
ambulatory
it's just something I
EEG
had
is
to do that for
different,
like a
though.
month. So if this person's just doing it for a couple days or something, like, I feel like they shouldn't be so harsh on themselves. Like they'll get through it just fine.
The ambulatory EEG is different, though. Like they have that thing all wired up into you with their glues and everything. It's all on your chest and head and everything. Like they even tape it around your head with like that medical tape that they have.
Yeah, the clear like bumpy type.
It looks like
Yeah.
like a white ace band.
Yeah, that's why I'm wondering why they're not just taking a day or two off. I mean, maybe they're not able to. Maybe they just they have to work or whatever. I understand that, but it seems like something like that their job should be a semi giving them a concession or giving them a break on at least a day or two if they're going through something like that.
You guys should get Lunchables because I have a problem with eating, and that's the easiest thing to eat because it's just a cracker. I mean, a piece of meat on top of a cracker and cheese. They have these adult Lunchables too. I found this other one over
Out
at
of
Sprouts.
Lunchables.
Huh?
Out of the Lunchables.
It's like it's hard for me to eat sometimes. So when I get up and I don't eat in the mornings, like today, because I'm usually going to be here all day, a Lunchable is the easy thing to grab for breakfast. Yeah, it works.
Which Lunchable flavor do you have?
Ham and American.
Oh, ham and American. Okay.
Boogie, I'm not
shared.
sure if you can show the picture I just put up in the chat, but that was me wearing the ambulatory EEG.
Oh, on the noggin.
Yep. And that was just part of it. Like, that's not even what they had on my chest, and me carrying the whole thing around. Like, you're going to be carrying that whole EEG thing around.
Guess what I have on? This is what I was wearing when I had my seizures. The Christmas pants.
Oh, can't see. Oh, wow, Angel. Dang. Yeah, I would just put a hat on over that if I had to go to work.
Oh yeah, you definitely couldn't tell if you wore a hat. You look like you're
I
Muslim.
wore a bandana, but yeah.
Pookie.
You look like you're practicing Islam.
Pookie.
That's what they cover you up with and
Hold
everything.
on 1 second, Kylie.
Okay.
That's similar to the one I had.
Mm-hmm.
Oh man, I haven't had to do one at home to get the cap and all that, but yeah, that's some work. That doesn't look that bad though.
And you will be carrying that big bag around. So yeah.
Oh, I don't even know what that looks like, to be honest. This is to the post where that says the ambulatory EEG at work. The first comment here says with a beanie on sand, the wire, in quote, tail under the jacket. I looked way more normal than I was expecting. In a science environment, I think it would be fine as long as you don't mind having the same, in quote, ooh, EEG conversation. Another one says, yes, I had an ambulatory EEG last year and still went into work, wore a beanie. No one really noticed or cared.
Snowblower.
A snowblower? Oh.
Bad minute. It's the free site on here.
Yeah. So I'll move to another one. How do I balance school with seizure meds? I know not a lot of us are still in school. Let's just try to give some advice. It says, hi, I don't know what to do, so school is getting a little messed up. I've had these episodes at school and one in the hospital recently. It's to the point that the neurologist gave me seizure meds. I'm on 2 different types right now, and the diagnosis isn't even concrete yet, but I'm still taking them just in case. I'm not entirely sure what to do. The meds make me tired, sleepy, and moody, and it's affecting how I study. I'm worried about my test and university exams later this year. How do you handle studying while on meds? I also feel emotionally unavailable, if that makes sense. I'm really, really lost, tired, and frustrated because nothing feels normal anymore, and I'm worried about school. Please give me advice. Keep your head up. Keep pushing. I'm not going to say it'll get easier. It'll get better within time. I know dealing with school that can be hectic because you got to worry about making your health better first before you can even worry about doing school. So yeah, I understand what you mean. It's going to take some time and some patience. Yeah. You guys, Angel?
I remember, it's been a long time since I've been in school, but I remember and I was on definitely more than one med too, and it is tough. My dad was complaining to the neurologist I had back in the 10th grade that I was pretty much sleeping all day long. And it is really, really, really tough on a teenager, going through that. So it will affect you big time. And yeah, I think I was on heavy doses too. I think if I pull up my medical records, I can probably see how much, but I'm pretty sure it was like 1,500 milligrams of one pill and like 500 milligrams of another pill. And yeah, it was really tough to stay awake. My grades were definitely dropping. So it is tough, but your health does come first.
It's your health first, and everything else comes after. One of the comments here says, first, let your neuro know about the meds are making you feel. Second, talk to your teachers and let them know what's going on. Yep. Exactly how I felt. Twisted, you didn't have seizures when you were going to school, did you? I got something here. It says, rescue pill. Good morning. I would just like to ask, what are rescue pills some of you take, some of you talk about, and how do you use it? The closest I get to a rescue pill is Ativan, but then also it still has to dissolve. I don't have a rescue pill. Does anybody have a rescue pill?
I do.
Please explain.
When I get a cluster or get dizzy, I take it. The Klonopin, the famous Klonopin.
Hi.
Angel? Oh, the question also was, how do you use it?
Oh, sublingual, or I take it as a normal pill.
Okay.
After my cluster started, my first one was also Klonopin, and it was dissolvable. So as soon as you put it in, like basically on your tongue, it starts dissolving, and once it goes in, it's working right away. So yeah, that was my rescue pill.
Okay.
There's two more rescue medications. Nasaelim and
Nasalim,
Beltoco.
Nasalim is a nasal spray.
The Beltoco is also spray.
Yeah.
Um,
But I think the rest of them that come in pill forms will be dissolvable, and as soon as you start seizing, it's put in right into your mouth, pretty much.
Off
And
topic. They have an anal suppressor. It's a rescue med.
I've talked about it since the day I came on the podcast.
Oh
And
yeah.
it's called clonazepam and diazepam or diazepam.
Okay. Yeah. I'm sorry you had to go through that. Will not like to go through that. It's a rescue med, Angel.
No, I wasn't given that option, but my friends in the UK have told me that they gave each other anal.
I couldn't imagine that having to save someone doing that. Like, this is gonna save you. You'll be better. Oh my.
Relax.
That's just something I don't want to wake up from a seizure and I'm wet down there. I'm just be like, I got a problem. To everybody who's standing around me, we got to talk about what has happened.
I don't want no Diddy stuff going on.
AJ has pretty wild stories.
Ivan, how you doing?
Yes, I'm good. I'm good. Buki, all guys. Thank you very much for asking.
Yeah,
How about
glad
you
you're
all?
doing good.
You want to ask Ivan the icebreaker?
Honestly, I forgot what it was. Oh, the
It's
icebreaker today
okay.
is
It's okay.
oh, I forgot again.
It's okay. It's okay, Buki. It's okay. It's okay, Buki. It's okay. It's okay. It's okay.
Oh, is there a goal that you made that you still have yet to achieve?
A goal? No. I absolutely right now, no. I don't have. Because it's I can't do nothing. I'm imagining like living like zombie, right now. So I can't I can't have a goal right now. I don't know.
Gotcha. Okay, I got another post here. It says, "Help, please. I'm a healthy 26-year-old male with no previous seizures. However, I just got married and I was coming back from our honeymoon. On the last flight back home, I looked out the window as we were landing when my body started to lean into my wife without my doing so. That's all I remember before the seizure occurred. Next thing I remember, I was in the back of an ambulance on my way to the hospital. I was extremely disorientated. I spent 2 nights in the hospital getting an MRI, EEG, and ultrasound of my heart. The doctors didn't find anything abnormal, and after I got some sleep, I felt completely fine. So I was released, but got recommended to not drive for 3 months. The doctors believe it has to do with the 3 hours of sleep I got before all the flights back home and dehydration. Has anyone experienced this before? Does anyone have any ideas as to what caused this or can affirm the doctor's guesses? And thank you.
Dehydration and lack of sleep, changing of the what do you call it, like the air level because you're flying.
Mm.
Oxygen levels,
Yeah, oxygen level.
hypoxia. It's the medical term.
Mm.
Those could all be causes to this exact seizure if it was indeed. I'm not a doctor to diagnose if it was or wasn't,
I'm not. Neither do I.
but it just go keep on getting um your tests done, and I do recommend not driving just in case because
No driving.
um I will say back when I originally started having seizures, there was definitely a little period in time, and that was about the same amount, probably a little bit more or less of how many months that it took between the second one, and then as it went to the third one, it went faster, and it kept going faster until they got me on the right meds. But that's just in case. I mean, I hope it's a one and done and you're not epileptic, because it's not a life I wish for anyone.
Gotcha.
Yeah,
A couple comments here. One here says, OMG, this is my fear every day. I check my babies, 1 and 2, then my husband. I am so very, very sorry for your loss. Another one says, 21 when I was diagnosed and started meds. Another one here says, always a strange feeling arising from before the blackout or a seizure, and usually happens when I had enough sleep, when I hadn't had enough sleep the day before. And for me, caffeine and Dota 2 caused me more triggers than alcohol. DOTA 2. Is that Dota 2? Yeah.
sorry, what?
It says, and for me, caffeine and Dota, DOTA 2.
It's a game. It's a game, Pookie. It's a game.
Oh,
I was looking it up.
PC game. PC game.
okay, because I was confused. I thought I was going to say Doja. That's what I thought. I was going to go back to that.
No. It's a PC game. PC game.
No.
So they could be possibly photosensitive if it's a game.
Yeah. Good on pointing that out, Angel, because that is a good thing. Got something here. It says, I am undiagnosed and not sure if I should be concerned. I'm going to a neurologist next week. I have seen an increase in my myoclonic jerks the past 2 months, but the past couple of days, I have had some that are sort of a full body jerk. It looks like I'm being electrocuted. My shoulders and my head shake violently for like 3 seconds, like I'm a rag doll. Has anyone else ever experienced this? Right before, I get this foggy feeling in my head, and it's gone immediately after the jerk.
Definitely.
You said you've got that, Twisted?
Definitely epileptic.
Yeah, it
I'm
sounds
no doctor. I'm no doctor.
Kevin would be best, but he's not here right now. But it sounds myoclonic, and it sounds like they're ramping up. Maybe meds are, if it's like mine, where you have refractory epilepsy, it's where you get to the point where your tolerance levels, the medication, they can put it up, and you're just pretty much immune, and you will still keep having your seizures. So they may have to try new medications or try other things.
With this post here, this is actually from somebody that we know. Her name is Nikki. She hasn't been here in a while. She has not been diagnosed, but she is having seizures.
Hey, Mark.
Hey, Mark.
Hey guys.
Hi, Mark.
Hello, Mark. We gotta ask Mark the icebreaker.
Oh. The icebreaker today is, what is a goal you have that you have yet to achieve? Doesn't have to be a goal with epilepsy.
Oh, well, can it be one anyway though?
I mean, that's kind of the easy way out.
Yeah, the easy way out. That's me. 6 months seizure free, let's say. I've not hit 6 months seizure free since beginning care with my epileptologist team there. So yeah, that'd be nice. Don't need to be seizure free forever, but 6 months.
Have they ever gave you like a reason that you have epilepsy?
No, not really. I've wondered about that, but there's not really any. I don't know. As long as the MRI came back clear and there wasn't any sort of like structural abnormality or tumor or anything, that was the big like possibility. Aside from that, it seems like if that's not something easy to identify there, then the odds of actually finding any particular reason that the epileptic seizures are happening, as opposed to just a location that they're beginning from, then it seems like it's a lot less likely. So
It could be
I'm
genetic.
not optimistic about that, but I don't really mind either. I don't need to know why I'm having seizures to have no more seizures. I just need to stop them, right?
Yeah, I feel you. I stopped caring about why, like why they started.
Yeah, I agree. I agree very much.
Today there has been quite a bit of posts about weed today.
About what?
People are getting really curious. Yeah, so I got another one here. It says recreational weed and seizures. Can someone let me know if smoking weed can trigger a seizure? I've been diagnosed with epilepsy like around 2 months ago, and I've upped my Keppra dosage to 1,500 milligrams like a week or two ago. I'm wondering if it's safe to smoke a little with a friend, or could it trigger a seizure? Please let me know. Everybody's epilepsy case is different. Everything can react different with a different person. I've been smoking for a long time, so I don't know. I didn't really stop when it was time when I got epilepsy. It wasn't like, oh, you need to stop smoking.
You were a toddler, right?
Huh?
You were just a toddler?
Come again?
You were just a toddler when your accident happened?
He was 5.
5?
Mm-hmm.
Toddler.
Kind of toddlerish, but no, I'm saying once I was diagnosed with epilepsy.
When?
I wasn't
16.
diagnosed at 5, but yeah, once I was diagnosed, I think I was like smoking here and there, and I was at 16. And then once I got out of high school, I became an everyday smoker.
What do you smoke now, Pookie?
Can smoking trigger a seizure?
It's very unlikely that it can, because weed actually does the same. Weed actually does some of the things that the AEDs are meant to do and calm the neuro things of the brain down. I can't pronounce it, but it does the same thing. So it's very unlikely less. But because if you're on medication, yeah, it might. If you're not telling your doc, like I said earlier, if you're not telling your doctor that you're smoking and whatever, and it might intervene with your medication levels. Interfere, not intervene.
Hey, Ivan.
Yeah, I heard that for a cigarette, it can cause for the medication. What do we say? Medication to maximize the medication. help me to help me
Threshold?
to
Threshold.
sorry.
Threshold?
Threshold.
Threshold.
Yeah, like to
Interact?
yeah, the the medication to affect. Ah, my God. Affect us medication to be affected to us. Do you understand what I mean, guys? That
Yes.
so if we smoke a cigarette, the medication will be reduced.
A
The
cigarette or a bud?
sorry,
A cigarette, like
cigarette like this,
like this,
like this,
like this.
like this. Yeah. Like that.
I smoke regular cigarettes. And I see no changes.
Yeah. Yeah, me too. I felt that too. Z. But I don't know. After I've done some research, and my doctor too said that it will, especially for Trileptal. I drank
Oh,
Trileptal. It say that will reduce the something like the in it. You understand what I mean?
I can't take Trileptal because it gave me the rash. So allergic.
That's
I
so.
see.
So you got like the rashes and stuff.
Yeah,
Was it itchy?
allergic.
I said, was it itchy?
Who are you asking?
Did the medication make you itchy?
Who are you asking?
Z.
Oh, Dilantin, Keppra, Trileptal, Probably
Proviac probably be on that list.
yeah.
Yeah, because I hear people saying that they got a rash, but I was just asking, like, does it itch, or is it just something
Yes.
you just notice is there?
And I immediately called my neurologist, epileptologist, and I told her, and they discontinued my Trileptal. But it wasn't because I smoked.
I got something here. It says breakthrough absence seizures with GTC. I started having generalized epilepsy for almost a year now, and I wanted to know how many of you are experiencing the same thing. I'm just having a hard time getting situated with all this, looking for a better way to look at things. I feel super hopeless, like there's not really anything going to make this any better. I can sit down and watch TV without someone stressing out and asking me if I'm okay. As sweet as it is, I don't find comfort in stressing out my loved ones because I go, end quote, damn, if I stub my toe because they assume it's the worst. I feel like I'm getting more stress than support. The question here was, wanted to know how many of you are experiencing the same thing, breakthrough absence seizures.
I am.
Yeah, I'm not getting absences, but please explain, because isn't an absence like a focal unaware?
It's pretty much it goes along the lines with if you're diagnosed generalized, if you're getting treated generalized epilepsy, it's also like you're pretty much having absences too, but not always, but yeah. You're pretty much like 30 seconds, 40 seconds into going absent, and it can look different ways. You can be lip smacking and stuff, or just staring like at a wall, or for no reason. And it's just a stare. But you will feel confused and lost as hell when you come out of it, especially the longer ones.
So you've had basically focal unawares. You never like wander off, never?
I never wandered around like you have, Pookie. No. My original diagnosis was complex partial with second generalization, which is now called focal.
Where?
No, it's called focal to bilateral.
Oh.
Seizures. So yeah, I do have focal awares now. Like they started more recently, and they're scary for me. But
yes,
when I was diagnosed in 1997 till like 2022, they all been unaware. And I think prior to that, like my neurologist said, I should have been like JAE should have been a diagnosis on my charts, because I was suffering absences. I think he I don't know if it was something my wife at the time, my ex-wife, said to him, or he actually saw it. And I think it was like a real early into seeing this neurologist, which is I'm now at a level 4 epilepsy center, and I am seeing pretty much the head of division. So he sees a lot of things. And he informed me of like, yeah, you're having absent seizures and everything. And
You see, there's a little smoke. You might notice my diffuser is on.
I have juvenile myoclonic epilepsy or Jacksonian seizures.
that way you have?
Jacksonian seizures, is that another name for juvenile myoclonic epilepsy?
No,
or is that
that's an actual seizure type.
okay?
Hey,
I
Z,
think that's a rarer one too.
I think the seizure I had on November 13th, I thought was a Jacksonian because my left pinky felt weird and my right foot felt weird. Are you having Jacksonians?
Yes, according to my doctor.
It's like one leg stiff and one pinky numb.
I had let me
I got something here. It says, Xcopri fatigue, high all. I'm 10 days into my titration for Xcopri, and I'm so tired and always dizzy. I'm having a hard time feeling hopeful for this medication because I'm also still having seizures. So I'm wondering if the fatigue goes away ever, or this just how it'll be. I know it's different for everyone, but I just would love to hear from someone that has had success to get my hopes up. I'm also on lamotrigine and Vimpat, and they are not controlling my seizures. So Xcopri is kind of a last-ditch effort, and I'm trying to get under control before moving to surgery.
Yeah.
Anybody taking Xcopri, lamotrigine, or Vimpat can respond to this. I have not. Wait, I do take lamotrigine, so go ahead, Angel.
I'm in the same boat with the Xcopri, and it seems it hasn't held back every seizure, but it seems to be working for right now. I do have refractory epilepsy, so for how long it will work, that depends to remain until my tolerance level builds to it, you know. I guess because, and I haven't even been on it a year yet, and I'm already on 300 milligrams.
What's the highest dosage?
400.
Oh, fuck.
So you're at your max dose?
No, I'm not at the max dose yet. I'm at 300.
Oh, okay. I'm sorry.
And the fatigue does stay. It is a strong with the fatigue, at least for me.
Okay. Ivan, have you taken Xcopri before?
Never. I don't even understand what is Xcopri.
It's a medication.
Obviously.
Maybe you should explain it to him by the brand, no, by the generic name.
It It's I forgot the generic name. Um,
Is it
Is
Clonopin?
Bratican?
is
Big
not.
Bratican?
No, this is a clonazepam is Schedule 4. Excopri is Schedule 5. It's a stronger med. It usually takes a while to get up to it. They don't give it out to people right away because of like how much people can probably get addicted to it.
Cenobate.
Cenovate.
Mate.
Yes.
Clobazam? Clobazam?
No.
No, it's Cenobate, I think she said. I think that was the name.
Mate.
Yeah.
Mate.
It's a stronger narcotic.
I think
To
it's
try to
still trade name only too, like brand name
Yeah.
only. It doesn't have a
Yeah.
generic, so
Nope.
it'll be expensive to everybody who gets
Mhm.
prescribed, regardless of how
A
good their insurance is.
a refill will roughly cost about $1,200.
Wow.
Wow.
A
Damn.
refill for how long? A month?
Yeah.
Damn.
Right.
Does the company have any sort of financial assistance, like payment assistance programs?
I got mine through my medical insurance, so I don't know. I didn't have to go through that route, but
Have to go.
I have remember when I was looking up Excopri, there have been people who were denied like straight up and they wanted to and it was just like very hard to get it. Like even with being prescribed by their doctor, it was very hard.
Like hard to find in stock, or
No, it was
just
very hard.
difficult to get a doctor to even prescribe it to them?
Like even with me, I had to wait a few weeks with between the insurance and the pharmacy, and because the doctor like pretty much prescribed it and said, yes, this person's went through all this. Like, I guess before they put you on Excopri, you got to pass like a certain amount of pills before, yeah, you can take it. You failed this many pills, yeah, you can take it.
I got something here. It says, how do you get used to not driving? I am in the process of getting a diagnosis for my seizures, but it's been a very, very long journey. I was never told to not drive until recently, and I was told no driving until I'm 6 months seizure free. I made the whole month before having another one last month, so all that time was lost. I feel like I'm going crazy. I'm used to being able to do what I want when I want. I also have 2 toddlers that I can no longer take places without help, and I only have so much help. How do you guys manage? And do you have any tips that can make this process easier? Thank you, guys.
Public transportation and family and friends.
Yeah, that's right. That's very, very right and true.
Find a good
Family.
support system.
Yeah, family.
I can say that having no one to talk to about your epilepsy can be bothersome. Me having no one in the beginning wasn't easy for me. I'll put it like that. Me having no one to talk to and express my thoughts to was really hard, and I rebelled, not even having to. I was rebelling, and my mother didn't even know I was rebelling. She just thought I was out with friends. I was just doing dumb stuff, and I wish I would have pointed something out to anyone, but I didn't have a support system back then to say, hey, you guys, this is what's going on. This is how I'm feeling, and help me with this. To not have that or anyone to tell I'm feeling bad. What do I do? Now I have you guys. I can ask you guys, what do you think? I'm feeling like this, and you guys know exactly how I'm feeling, what I did, or what you know someone did. It's easy to have a support system and go through this. It can be really rough.
It was definitely like that, Pookie. Definitely the same way. It was like I knew nobody. I think we all did. We knew nobody else with epilepsy.
I thought it was only me.
Sad.
Mhm.
Like, I'd never heard of anybody with epilepsy, and I'm from a small town. But it's like something with me, I guess. People just get picked up from an ambulance. I see people getting picked up by an ambulance all the time. I just never assume it's epilepsy. But yeah, for a long time, I thought it was just me. I was in a why me phase to where I felt like I did nothing wrong. And yeah, the depression was a bit of a wake up call.
But
For
I'd
me,
always assumed it was something you were born with, or that I didn't know that it could show up later, come later. I'd only heard about it as this kind of diffuse, scary chronic illness. And I wasn't born with epilepsy, so I thought I was safe. I didn't have to think about it or worry or research at all. And yeah, it only took 30 something years to shake me of that delusion. Um,
For me, it took 14.
yeah, for me, in driving personally, it feels like, if we imagine as a man drive by the wife, it's kind of a shame to be to be honest, as
yeah.
a personal person, as for me personally, it's feeling like sh- feeling a bit ashamed, because I look at my father and my brother. They can drive their wife and their wife as a man, but me drive by my wife as the opposite side. It's a bit feeling, I don't know. It's just my I don't know.
Gotcha.
Yeah, yeah.
How long ago were you diagnosed with epilepsy?
Who?
How long have you had epilepsy?
Me?
Yes.
Oh, me. I have around for I have epilepsy since 15 years old, and I'm 37 years old, 37 years old right now. Almost like
Oh,
you, Pookie. Almost like
so,
you.
yeah. Yeah. I got mine at 15. No, at 16. And I'm now 36. So that's 20 years. You got yours at 15, and now you're 37.
Yeah.
That's 22 years.
Yeah. Almost like that. I said that was Pookie. That's like me. I heard
I
from
was
your
Angels had it
14.
story.
for 100 years.
I was 14 and now I'm 42.
Wow, Angelito, both.
Angels had it since the dinosaurs were here. Oh man. Um, there was something I was gonna say. It had to do with Angel. Forgot what it is.
I'm a dinosaur.
A wise one though. But that's not what I had to say.
Which which do you think was the wisest dinosaur?
The angel. No, I'm just kidding.
The Angelsaur?
Angelsaurus. Um,
Probably one of the herbivores.
I got something here. It says temporal lobe epilepsy. I have a brain lesion, cavernoma, focal epilepsy, and psychosis, which they say is my caverna is probably causing. I also had a diagnosis of bipolar changed to psychotic disorder as my psychosis was happening even outside mood shifts and seizures. Has anybody had anything similar with multiple problems? I'm on lamotrigine, which stopped the mood shifts and seizures. Also, does anyone get a strange sensation like a pulling feeling in their chest or heart, like it's leading you somewhere? It comes with a sick feeling, sometimes losing ability to speak, or an intense anger.
That might be the aura.
I was thinking that it might be an aura. Yeah, I don't have temporal lobe epilepsy, but there is one comment. Huh?
Sorry. Go on. Go ahead.
You go ahead. I was just gonna read a comment.
To be for me, I've diagnosed for bipolar at first, and then because I have mood personal issue, because when I'm good, when I'm stable, I'm stable as a normal person, and suddenly I'm down and I have to be accompanied by my wife and talk chat because I'm an extrovert person. I have to be accompanied by my wife and have a chat and talk and something like that. So yes, I have that feeling. It's common for me. That's why my doctor give me a Depakote and Abilify and yeah, something like that, medication for stabilizing my mood, because my mood is not stable enough for living my life stable, if you understand if you understand.
Yeah, I got you. You're up early. It's early in the morning there. It's like
Yeah,
what,
it's
8 o'clock?
7 o'clock. 6:50 to only 1 hour different, but opposite side. It's AM in you. Sorry, AM in me, PM on you maybe.
Yeah.
6:52 a.m. there?
6:52 AM. Yeah, that's right. 6:52
Okay,
AM.
yeah. So
Wow,
that's
you're 12.
exactly 12 hours off from the
Where we're at.
Eastern United States time
Yeah,
zone. So
I'm in
yeah,
Indonesia.
that's
So 12, so that will be 15 for Pookie.
that's
Yep.
yeah, that's gonna be really easy to remember.
That's why I ask people. I try to get the time differences. Like you got the time difference for AJ. AJ is 9 hours ahead of me.
Ah,
And that's in Romania.
So that would be 6 hours from here, right? In
Yes.
the Eastern US. You're 3 hours.
Yeah, so we just got to figure out the Middle East. in Africa. We've been going around the continent for a bit.
I mean,
Yeah, we gotta.
it should fall somewhere. The time zone for Romania should fall somewhere in a strike through Africa, right? I gotta look that up now. I can't leave that alone.
We
That'll
met one person in India. Yeah, he didn't turn his camera on. But yeah, we met one person in India. Good person, good guy. He actually talked to us a lot. Yeah, there was another guy that came. He was from India, and he said he couldn't turn his camera on because of it's a big deal to be there and be. He was a gay a gay man, and he was just basically like it's too much to be on camera and stuff like that. But yeah, we've had two people from India now that I think about it. Next,
Romania is the same time zone as South Africa, in case you needed to know that.
how many hours ahead is that? 9, 10?
Romania is 6 hours ahead from Eastern time.
Yeah.
So yeah, it's wait, is it 6 hours or was I?
Well, if it's 10 hours from Pookie, that will mean it's 7 hours from us.
7 hours. Yeah. Yeah. Okay. That will not be as easy to remember. To 7 plus 6. Yeah.
You must take a notes, Mark.
I must what?
You must take a note, make some notes.
Yeah. Well, or
No, I'm just joking. I'm just joking.
Yeah.
You can set a lava lamp to turn on 7 hours ahead, and that will tell you, okay, that's Romania's time.
Yeah.
Do you have lamps that turn on at a certain time?
Yeah, they're all on a timer to turn on at about 5:30 a.m. so that they have time to warm up before I actually get up and get out of bed.
Oh, nice. Do they keep your room a certain temperature?
They warm it up. They don't keep it a specific temperature. That's actually kind of a problem. They can make things in here really toasty. So I gotta choose between having like a chill vibe or being like comfortable. So it's kind of a coin flip some nights. But yeah, it's not so bad now with the winter weather. You can always just open the window a bit and cool it off here. And in the summer, the air conditioner turns on. Excuse me. The air conditioner turns on enough to keep things cool anyway. But it's these little like the spring and the fall when it's nice outside, but not like cool enough so that opening the window cools it off in here. But it's too nice outside for the AC to kick on, so it just gets hot in these like in this whole side of the house. But why am I even talking about this? Like the bedroom,
It's okay,
the
Mark. It's okay,
temperature, air
Mark.
conditioner.
It's okay,
I
Mark.
don't know. The yeah, they just had the like the AC ducts all cleaned out today. These guys are big vacuum cleaners running, and so that got all noisy. That's probably why it's so fresh on my mind. But yeah, it's I should just not turn on the lava lamps so much if it gets to a point of being a problem. But
Oh no, they're not a problem.
no, but the heat, when the temperature gets to the point of
Oh.
being a problem, I should. Yeah, I don't know. Maybe I should just use the ceiling fan a bit more. It just moves the warm air around sometimes, so it's not always a solution.
Everybody's body is different, and we're not doctors.
Please take medication as prescribed.
Please take your medication as prescribed.
I'm about to go to bed.